feel a pinching sensation whenever you raise your arm overhead? Do you hear or feel a click in your shoulder as you raise your arm? Do you feel a clunk in your shoulder as you lower your arm? If you do, most likely you'll have some type of instability in your shoulder, specifically your glenohumeral joint. Your glenohumeral joint is what we call a ball and socket joint. And this ball and socket joint is supposed to be a almost perfect fit. The head of your humerus, the ball, is supposed to fit snugly inside the acromion, the socket. The capsule that forms the socket is consisted of various tendons that help to stabilize the shoulder. When there is decrease in the strength of these stabilizing tendons, you have an unstable shoulder. One of the most common symptoms is the clicking noise. Very important skill I like to teach my patients who have shoulder instability is how to engage the lower trapezius. The lower trapezius is an interesting muscle that travels all the way from the glenohumeral joint to the scapula, or shoulder blade. Its function is actually to depress the shoulder blade. And this is an important function because it allows the ball of the shoulder to be closer connected to the socket. There are various levels of this lower trapezius activation. Today we're going to go over from the most basic level to a somewhat advanced level. For the most basic level, you can start in the sideline position. What you're going to do is you're going to bring the lowermost tip of your shoulder blade down and back, like this. Note that you're not moving your elbow, you're moving your shoulder blade. It might seem that I'm moving my elbow, but I'm only moving my shoulder blade. The next level is resting your arm on a wall like this, and then engaging from here, engaging your shoulder blade from this position. So as you can see, the arm is somewhat supported. You can practice doing this. The next level is to do this without resting your arm. And you can do this in just a regular upright position. Please note that we are not pushing the shoulder blades as far back as possible, bringing slight tension into the shoulder blade. And it's not a horizontal retraction like a scapular retraction, but rather is more of a downward and angular diagonal. Now, some people like to teach this on a point of a numerical clock. So you can kind of imagine that this over here, this here is 12 o'clock, this is 6 o'clock. If you can see this over here as 1 o'clock, the opposite, 1 o'clock, 7 o'clock. So it's 1 to 7, 1 to 7. When I bring my arm out here, it adds some resistance or challenge because of gravity. Here, I'm going to engage, and you can kind of see my shoulders kind of get pulled into the socket. And that is the kind of imagery you want to have in your head when you do this exercise. Just note that my hands are not behind me, rather they're somewhat in front of me. If you bring them behind you, while that is also engaging lower trapezius and some of the middle trapezius muscles, you also put the front of your shoulder capsule more at risk for pinching. Once you have mastered this movement, it's important while you're practicing your lower trapezius engagement, it's important that you're not elevating your shoulders. So when you're shrugging, that means you're not activating your lower trapezius properly. So you want that to almost drop down a little bit instead of shrugging. once you can maintain that tension in lower trapezius, when you raise your arm, your shoulders will not rise, so there's no shrugging. So you're not doing this. Engage lower trapezius, raise arm, and back down. This is going to make raising your arm overhead more difficult because of the tension in the lower trapezius, but this is on purpose so that we can challenge lower trapezius to make it stronger. While you can make this movement more challenging by using resistance bands or holding some type of weight in your hands to make the movement more challenging, it is actually not very necessary, because if you have instability over your lower trapezius will fatigue out after less than 10 repetitions. So all you need to do is to be consistent with the exercise of shoulder scaption, and you do 3 sets of 10 repetitions, or you can do 4 sets if it starts to become easier. That way, you'll get to a point where it is not bothering you as much, it is not pinching as much, it is not aching as much. If you have increased tension or tightness in either your pecs, upper trapezius, or your neck, it could limit your ability to control your shoulder blade to do the necessary movement. If this is too tight here, you won't be able to drop your shoulder. If your pec is too tight, you won't be able to bring it back as easily. To decrease tension in your pecs, you have to stretch them. So here is your typical pec stretch. You can do this on a wall or a door frame. However, if you have discomfort in the front of the shoulder because of shoulder instability, you can do the stretch instead. You will stretch a different part of the pec. It will still help to decrease tension in your pecs, and it won't put as much pressure on the front of your shoulder capsule as if you do it the regular way. So a little higher, like that, instead of here. To decrease tension in the upper trapezius, you could do an upper trapezius stretch like this. However, I actually would recommend massaging this area before you stretch. That is more effective in decreased tension and also more gentle to this area. I made the video detailed